Imagine this. You're just, going about your day.
Yeah.
And your cat, who seems perfectly fine, suddenly just collapses.
Yeah.
Their body goes spiff.
Yeah.
They start paddling their legs. Maybe they wet themselves. It's absolutely terrifying if you see it.
Oh, absolutely.
What you're probably seeing is a seizure. And, well, the sources you shared for this deep dive say that while it's less common in cats than dogs, it's nearly always a sign that something pretty significant is going on.
Exactly. We've really dug into a pile of clinical guides and specialist resources you sent over, all focused on feline seizures.
Right.
And the goal today is really to help you unpack what these things are, look at the incredibly varied, sometimes really surprising reasons they happen, how vets figure out the cause, and what treatment looks like.
So people can feel a bit more informed. Yeah.
That's the idea. Understand the complexity, know what's key.
And straight off the bat, one thing that really jumped out from these sources is this big difference between cats and dogs.
Mm-hmm.
With dogs, you often hear about idiopathic epilepsy seizures with no clear cause. But these guides really stress that for cats, most seizures seem to have a traceable cause, like a structural issue in the brain, or maybe a metabolic problem somewhere else.
That's such a critical point. It completely changes the approach, doesn't it?
How so?
Because for a cat having seizures, finding that underlying reason isn't just academic, it fundamentally shapes the entire diagnostic path and definitely the treatment plan.
Got it. Okay, so let's start with basics. A seizure, what is that exactly, and how is it different from epilepsy?
Okay, so a seizure is the actual event, that temporary burst of abnormal electrical firing in the brain that causes the signs you see, the shaking, the twitching, whatever it is.
Right, the episode itself.
Exactly. Epilepsy, though, that's the condition. It means having recurrent seizures that aren't triggered by something immediate and reversible, like, say, swallowing a poison.
Okay, so the seizure is really just the symptom. Like a cough could be anything from a minor cold to something serious.
Precisely. It's a red flag saying something's messing with normal brain function, and that something could be inside the brain, intracranial, or it could be the brain reacting to an issue elsewhere in the body.
Like a metabolic problem or a toxin.
Yep. Those are often called reactive seizures. The brain itself might be healthy, but it's reacting badly to a systemic problem.
And seizures don't all look the same, do they? I mean, what kinds of things might we actually see?
No, definitely not. The sources break them down. You've got focal seizures or partial seizures. They start in just one part of the brain.
So the signs are localized.
Often, yeah. Could be just one eyelid twitching, or an ear, whiskers fluttering, maybe lip smacking, or like they're chewing imaginary gum. Sometimes really weird stuff like frantic running, crashing into things, or circling, or just one limb twitching. And importantly, the cat might stay conscious, or their awareness could be altered.
And a focal one can spread.
It can, yes. It can generalize to involve the whole brain.
So generalized seizures involve both sides.
That's right, both hemispheres. The classic one people picture is the grand mal, the tonic-clonic seizure.
Okay, explain those terms.
Tonic is the stiffening phase. The body goes rigid. Clonic is the rhythmic jerking or paddling movements.
Right.
And you often see drooling, sometimes urination or defecation. Usually lasts a few minutes, typically.
And petit mal, absent seizures.
The sources say those are pretty rare in cats, just brief moments of staring into space, being unresponsive.
But one thing I found interesting in the guides was that non-convulsive generalized seizures are apparently quite frequent in cats. That seems odd if you're expecting the big dramatic shakes.
It does feel counterintuitive, yeah. But it's a key point. These might just involve facial movements like both eyelids twitching or whiskers, ears, maybe some drooling or lip smacking.
So no falling over and shaking.
Not necessarily the big tonic-clonic stuff, no. Maybe dilated pupils or some whole body trembling, but the facial signs often dominate. And importantly, non-convulsive status epilepticus, a prolonged seizure of this type is also noted as frequent and definitely an emergency.
Okay, so the seizure activity itself, that's the ictal phase. What about before and after?
Good question. The sources talk about 3 phases. Before the seizure, maybe minutes or even hours before, you might see the preictal phase, or aura.
What does that look like?
Behavioral changes, mostly. The cat might hide or become unusually vocal, restless, maybe suddenly very clingy, or start salivating more, just not themselves.
Then the ictal phase is the seizure itself.
Correct. The actual event. Seconds to minutes, usually. And sadly, the guides mention that sometimes self-injury can happen biting their tongue or breaking nails from the intense muscle contraction.
Oh, awful. And after it stops.
That's the postictal phase, the recovery. And this is super variable. It can last minutes or sometimes days.
Days, wow.
Yeah. Signs include things like disorientation, pacing around, maybe circling, pressing their head against walls or furniture.
Head pressing, that sounds worrying.
It is. It can indicate brain issues. Also, temporary blindness, being suddenly ravenous or incredibly thirsty or just being completely wiped out, lethargic.
It sounds like some of these situations need immediate vet attention, right? Emergencies.
Absolutely. Two big ones highlighted in the sources. First, cluster seizures. That's when a cat has multiple seizures within a 24-hour period, even if they recover a bit between them.
Okay, multiple in a day.
And second, status epilepticus is even more serious. This is either a single seizure that goes on for longer than 5 minutes,
5 minutes, okay.
or it's multiple seizures one after another without the cat fully regaining consciousness in between. That's a massive, life-threatening emergency. Needs immediate vet intervention. Brain damage can happen fast.
And the non-convulsive status epilepticus too?
Yes, absolutely. Just because they aren't having the dramatic convulsions doesn't make it less dangerous if it's prolonged. Still an emergency.
I also saw something called the kindling effect. What's that about?
Yeah, one source mentions this. The idea is that each seizure can potentially cause a little bit of neuronal damage in certain brain areas.
Oh.
And this damage might make future seizures more likely, or perhaps more severe. It can also increase the risk of status epilepticus. It's like the brain circuits get kindled easier to ignite into a seizure. Though they do point out this doesn't seem to happen everywhere in the brain.
That makes sense why stopping them is so crucial. Okay, so this brings us to the massive question. Why do cats have seizures? We keep saying finding the cause is key. Let's really dig into the possibilities.
Yeah, let's do it. Because, again, structural brain problems are so frequent in cats, the treatment really hinges on figuring out the why. We can split the causes into two big groups. Problems outside the brain, extracranial, and problems inside the brain, intracranial.
Okay, let's tackle extracranial first. Stuff going on elsewhere in the body that triggers seizures. What's high on that list?
Toxins and poisonings are huge. Really common, according to the guides, and something owners absolutely need to know about.
Okay, and one toxin really stood out to me. Permethrin. Parathyroids.
Yes, this gets flagged as extremely common. And the classic scenario, using a dog flea and tick spot-on product on a cat.
Oh, no.
Yeah, those concentrations are fine for dogs, but highly toxic to cats. It causes terrible tremors, hyperexcitability, their temperature shoots dangerously high, and seizures. It's such a vital warning for multi-pet households.
That's critical information right there. What other common toxins?
Antifreeze ethylene glycol causes kidney failure and neurological signs. Certain types of rodent poisons that affect the nervous system.
Things people might have in their garage or under the sink?
Exactly. And human medications are another big risk. Cats accidentally getting into antidepressants, ADHD stimulants, even things like decongestants with pseudoephedrine. Lead poisoning is also on the list.
Wow, so many household dangers. What about problems within the cat's body? Metabolic disorders?
Yep, several key ones. Hypoglycemia, low blood sugar can happen in young kittens if they don't eat, or in diabetic cats if they get too much insulin.
Okay.
Hepatic encephalopathy. This is from severe liver disease, like a liver shunt or fatty liver disease. The liver can't filter out toxins like ammonia properly. They build up, affect the brain. Cats with this might also drool a lot.
So liver problems can cause brain problems.
Directly. Same with severe kidney disease, renal encephalopathy. Uremic toxins build up when the kidneys fail.
That connection isn't always obvious, is it?
It really shows how linked everything is. Also, severe electrolyte imbalances can do it really low sodium or low calcium, which can happen after thyroid surgery sometimes, or even high sodium. Thiamine deficiency is another vitamin B1, crucial for brain cells. Lack of it causes neurological issues, including seizures.
What about hyperthyroidism? That's common in older cats.
It can contribute, yeah. Often indirectly by causing high blood pressure, hypertension, which then affects the brain's blood vessels.
Okay.
One source also mentioned polycythemia vera. Too many red blood cells makes the blood really thick, can impair brain blood flow, cause neurosigns. Sometimes you see really dark gums with that. And severe hypertriglyceridemia, high fat levels in the blood, is also listed.
That is an astonishing list of things outside the brain causing seizures. What about things like strokes, vascular events?
They happen in cats, though Maybe less commonly than in dogs, often secondary to those things we just mentioned: hypertension, hyperthyroidism, heart disease, kidney disease, which all damage blood vessels.
It all connects.
There's also a specific, rather grim one mentioned: feline ischemic encephalopathy, basically a stroke caused by the migration of a Cuterebra fly larva.
Okay, moving swiftly on. Any other extracranial causes?
Infectious diseases are a big category, things that might affect the whole body but can also impact the brain. Fale-E and FIV, the retroviruses. They can directly affect nerves or just make cats susceptible to other infections that do.
Like FIP.
Feline infectious peritonitis, yes. Especially the dry form. It's notorious for causing inflammation in the brain, leading to seizures. Also, parasites like Toxoplasma gondii, the Toxoplasmosis agent,
Right.
and fungi like Cryptococcus. Both can cause significant brain inflammation. Bacterial infections, too. Bacterial meningoencephalitis, inflammation of the brain and its lining.
Any others before we move inside the skull?
Just a couple more extracranial ones. Hypoxia, lack of oxygen to the brain, usually from severe heart or lung disease, and severe hyperthermia, heat stroke.
Okay, that covers the outside the brain triggers. Now let's shift focus. Intracranial causes problems originating within the brain itself. These are the ones leading to epileptic seizures, right?
Correct, because the abnormal electrical activity starts in the brain tissue. And like we said up front, actual structural problems in the brain are frequent culprits in cats. This leads to what's called structural or symptomatic epilepsy.
And what kind of structural problems we're talking about?
Brain tumors are a major one, especially in older cats, say over 10 years old. Meningiomas are particularly common in cats.
Meningiomas?
They arise from the brain's coverings. And the slightly better news is they're often benign and sometimes surgically removable. Other tumor types like lymphoma or astrocytoma can occur too. And the sources mention that sometimes owners notice subtle behavioral changes before the seizures start with tumors.
Like a gradual personality shift being a warning sign.
It could be, yeah. Especially with something slowly growing and taking up space. Then there's inflammation or infection right in the brain, encephalitis, or its coverings, meningitis.
Caused by those infections we mentioned. FIP, toxo.
Often, yes. Or sometimes it can be immune-mediated, where the cat's own immune system attacks the brain tissue by mistake.
What about head trauma? Like if a cat had a bad fall or accident in the past?
That's an interesting point where the sources differed slightly. One guide lists past trauma as a possible cause, maybe from scar tissue formation, but another specifically noted that trauma hasn't been definitively linked to seizure development later in life in cats.
Okay. So maybe not as clear-cut as in some other species.
Possibly. It highlights that vets have to weigh all the evidence, not just rely on one historical event.
Makes sense. What other intracranial issues?
Congenital problems the brain didn't form quite right from birth, or hydrocephalus, water on the brain, too much cerebrospinal fluid buildup. Strokes can also originate within the brain's blood vessels, although again, often linked to those systemic diseases. And then there's a really weird one.
Oh, I think I know what's coming. Feline audiogenic reflex seizures. FARS.
That's the one. It sounds bizarre, doesn't it? Seizures triggered by specific sounds.
Like what kind of sounds?
The sources give examples like crinkling tinfoil, tapping on a keyboard, rustling a paper bag, even clicking noises like a mouse or tongue clicks.
Seriously. Just everyday noises.
For a cat with FARS, yeah. It's a recognized syndrome, apparently more common in older cats. The seizures themselves are often described as brief muscle jerks, myoclonic seizures, but they can sometimes become generalized. And Burman cats might be more prone to it.
That is wild. And a bit unsettling if you have an older cat. Any other brain-specific causes?
Hippocampal necrosis is mentioned. That's severe damage or death of cells in the hippocampus, a brain area involved in memory, sometimes linked to autoimmune issues. But it's a bit of a chicken and egg situation, unclear if the damage causes the seizures or if severe seizures cause the damage.
Right. Okay, and finally, what about the one we said was rare in cats? Idiopathic epilepsy.
Right, idiopathic or primary epilepsy. The definition means recurrent seizures where you've done all the tests, blood work, MRI, CSF, TAP, and you find absolutely no underlying structural cause in the brain and no extracranial cause either.
So it implies a functional brain issue, but nothing you can see.
Exactly. And the consensus in these guides is that true idiopathic epilepsy, as defined like that, is considered rare in cats. It's a diagnosis of exclusion, usually diagnosed in younger adults, maybe 1 to 3 years old, but can happen at any age.
But didn't one source say something slightly different?
Yes, that's an important nuance. One source mentioned that epilepsy of unknown cause, where you suspect a structural problem but even the MRI doesn't show a clear lesion, is actually quite frequent in cats. Ah, okay. So maybe not truly idiopathic in the classic sense, but still no definite structural cause found.
Precisely. So while textbook IE might be rare, seizures without a clearly identifiable visible cause are not uncommon, and often vets still suspect an underlying, maybe microscopic structural issue.
That distinction is really useful. It really underscores why that diagnostic workup is so incredibly important, doesn't it? To try and sift through all these possibilities. What does that journey typically involve?
Well, the main goal always is to pinpoint that underlying cause because effective treatment really depends on it. And the owner you plays such a vital part in this.
We're the primary source of information, right?
Absolutely. A detailed history is priceless for the vet. What exactly did the seizure look like? How long did it last? How often? What happened before and after? Were there any potential triggers? A sound? An activity? Exposure to something?
Videos help.
Immensely. If you can safely record an event, it's incredibly helpful. Plus, info on the cat's general health, diet, any outdoor access, recent medications, or potential toxin exposures, all that context is crucial. Then the vet exam.
Yep, a full physical checkup and then a specific neurological exam. Critically, this neuro exam is done between seizures, the interictal period.
Why is the timing important?
Because if the vet finds neurological abnormalities between seizures, like changes in alertness, poor coordination, weird reflexes, issues with cranial nerves that strongly points towards a structural brain lesion, something is wrong inside the brain itself.
And if the exam is normal between seizures?
Then it makes a metabolic cause or a toxin or maybe that epilepsy of unknown cause more likely. Doesn't rule out a brain issue completely, but makes it less probable.
They look in the eyes too, right?
Definitely. A fundoscopic exam looking at the back of the eye, the retina, it can show evidence of systemic problems like high blood pressure or certain infections that affect blood vessels visible there.
What about initial lab tests? Blood, urine.
Standard first steps, usually a minimum database. CBC complete blood count checks for anemia, infection, inflammation. Serum chemistry panel looks at organ function, liver, kidneys, thyroid plus blood sugar, electrolytes. Creatine kinase, CK, can be sky high after the muscle exertion of a seizure.
Okay.
Your analysis checks kidney function, signs of infection. And given the viruses we mentioned, FLVFIV testing is pretty essential for cats showing neurological signs.
And if those basic tests come back normal, but the cat is still seizing?
That's usually when you move to more advanced diagnostics, often
Yeah.
means a referral to a specialist. And the big one here is an MRI of the brain.
The gold standard.
Pretty much, yeah. The sources are really clear. MRI is essential for spotting those structural lesions, tumors, inflammation, stroke damage, birth defects. It's the key to seeing what's physically going on inside the skull.
So vital for differentiating structural epilepsy from, say, idiopathic causes.
Absolutely crucial for that. Another advanced test is CSF analysis cerebrospinal fluid, collected via a spinal tap, usually under anesthesia.
Looking at the fluid around the brain.
Exactly. Checking for high protein levels or increased cell counts can point towards inflammation or infection, like meningitis or encephalitis. Though one source noted that giving steroids like dexamethasone beforehand can affect the results.
Makes sense? And specific tests for infections.
If things point towards toxoplasmosis or cryptococcosis or FIP, there are specific blood tests or PCR tests for those, although the guides mention that interpreting antibody titers can sometimes be tricky.
What about EEG? Measuring brainwaves.
Mentioned, but seems rarely done in general practice. Technically challenging on cats. Other imaging, like chest x-rays or an abdominal ultrasound, might come into play if the vet suspects the problem originates outside the head, like a tumor elsewhere or heart disease.
It really is a systematic process, peeling back the layers. But what about things that look like seizures but aren't? Are there mimics?
Oh yeah, important differentials to rule out. Syncope, fainting, usually from a heart condition, can look like a collapse.
How's it different?
Usually the cat goes limp, not stiff, then jerky. Recovery is often very quick. And there isn't usually that preictal or long postictal phase, maybe preceded by weakness.
Okay. What else?
Vestibular disease problems with the balance system, causes head tilt, wobbling, circling, but usually no loss of consciousness or the convulsive movements, narcolepsy or cataplexy, sudden collapse, but they remain responsive. Even severe pain episodes or certain behavioral issues can sometimes be mistaken for seizures by owners.
So the vet has to consider all those too. Okay, let's say the diagnostic workup is done. A cause is found, or maybe it isn't. How do we actually treat the seizures?
The absolute core principle, stressed in all the sources, is treat the underlying cause first and foremost. If you can fix the reason why the cat is seizing, the seizures themselves might stop completely.
So if it was that dog flea medication.
Exactly. Wash the cat thoroughly to remove the toxin, provide intensive supportive care fluids, temperature control, maybe muscle relaxants while their body clears it. If it's low blood sugar, give IV glucose. If it's liver or kidney disease, manage that condition. If it's an infection,
Specific drugs for that bug.
right, antimicrobials, antifungals, antiparasitics. If it's inflammation or immune-mediated, often immunosuppressants like steroids are used.
And for a brain tumor.
Depends on the type and location. Surgery might be an option, especially for those common meningiomas if they're accessible. Radiation therapy is another possibility. Or palliative care just to manage symptoms. If high blood pressure is part of the picture, blood pressure meds are key.
But what if the cause can't be treated? Or if it's that idiopathic epilepsy or epilepsy of unknown cause? That's when the anti-seizure meds, the AEDs, come in.
Yes, that's when you use maintenance anti-epileptic drug therapy. For symptomatic control when the cause is untreatable, like an inoperable tumor, or when no cause is found.
Do vets start AEDs after just one seizure?
Not always. The guidelines suggest starting long-term AEDs if a cat has, say, more than one seizure in about a 6-month window, or if they have cluster seizures or status epilepticus, or if the postictal phase is really severe or prolonged, or, of course, if a structural brain problem is found that can't be fixed. A single isolated seizure might just be monitored initially.
Okay. Which AEDs are the go-to options for cats?
Phenobarbital is often mentioned as a first-line choice. It's effective, been around a long time, relatively inexpensive.
Downsides.
It requires regular monitoring, blood tests to check the drug level is right, and also to monitor liver enzymes and blood counts, because it can potentially cause liver issues or blood cell problems. Though one source did note liver toxicity seems less common in cats than dogs, but monitoring is still wise. Side effects are common initially, too. Sedation, wobbliness, increased appetite and thirst, more urination. And one guide mentioned it can sometimes be tricky to fine-tune the dose perfectly in cats. Interestingly, one source specifically warned about potentially fatal liver failure with long-term oral diazepam, not phenobarbital, an important distinction.
Okay, so phenobarbital is one. What else?
Levetiracetam, brand name Keppra, is highlighted as a really good option, either first line or as an add-on.
Why good?
Generally very well tolerated. Few side effects, usually just mild transient stuff like a bit of sedation or maybe temporary appetite loss. It works quickly, it's considered safe even if the cat has liver disease, fewer drug interactions, and crucially, usually doesn't need routine blood level monitoring.
Ah, that sounds potentially easier for owners.
It often is, yeah. Seems to be particularly effective for those sound-triggered seizures, FARs too.
Any others?
Zonisamide is another one, used as an alternative or add-on. It does need some monitoring, though, blood counts and liver values.
Now, are there seizure meds used in dogs that we need to be super careful with or avoid in cats?
Yes, absolutely critical point. Potassium bromide, or KBR. It's used in dogs, but generally not recommended for cats.
Why not?
It carries a significant risk of causing a severe, potentially fatal inflammatory lung disease in cats, sometimes called bromism. Really dangerous idiosyncratic reaction. Should only ever be considered as a last-ditch add-on in very difficult cases with extreme caution.
Good to know. Any other drugs to avoid?
The sources list avoiding things like aminophylline, theophylline, common asthma meds, plus ketamine and fentanyl in cats known to have epilepsy.
Managing a cat on long-term seizure meds sounds like a big commitment.
Yeah.
What's the owner's role beyond just giving the pills?
Oh, the owner's role is absolutely fundamental. Keeping a detailed seizure diary or log is so important.
What should go in it?
Date, time, how long it lasted, what it looked like, the type of movements, severity, and anything noticeable before or after. This log is invaluable for the vet to see if the medication is working, if there are patterns, and to help adjust the dosage.
Makes sense.
Owners also need to know basic seizure first aid. How to keep the cat safe during an event, move furniture away, keep them from falling off things. But crucially, never put your hands near or in their mouth. You could get badly bitten or even obstruct their breathing. Just let the seizure happen, protect them from injury, and time it if possible.
And never stop the meds suddenly.
Never. The sources are very clear on that. Stopping AEDs abruptly can trigger withdrawal seizures, potentially even status epilepticus. If meds need to be changed or stopped, it has to be done gradually under the vet's direction.
That owner partnership seems key. Yeah. Okay, wrapping things up a bit, what about the prognosis? What's the long-term outlook generally look like?
It really, really depends heavily on that underlying cause.
So what are the better scenarios? When is the outlook good?
Often excellent or good if it's a reactive seizure where you find the cause and fix it completely, like the toxin exposure is over, the low blood sugar is corrected, an infection is successfully treated. Also, for cats diagnosed with idiopathic epilepsy, or that epilepsy of unknown cause who respond well to the AEDs, the prognosis for controlling the seizures is often good. Some sources even suggest cats might do better than dogs in terms of achieving remission and long-term survival with IE. And FARs, the sound-triggered ones, often respond really well to levetiracetam, so the prognosis for managing those triggers is usually good.
And when is it more worrying? Guarded or poor prognosis?
It's much more variable for structural epilepsy, depends entirely on what the lesion is. A small, benign, removable tumor is very different from an aggressive cancer or widespread, untreatable inflammation. The prognosis is generally more guarded to poor if the seizures are refractory, meaning they don't respond well even to multiple drugs, or if the cat suffers from recurrent cluster seizures or status epilepticus, or has really severe underlying brain disease.
Can the seizures themselves cause lasting damage, even if they're somewhat controlled?
Yes, the guides do mention that repeated seizures can potentially cause ongoing damage to brain cells over time. That kindling effect may be contributing over the long term. It could possibly affect cognitive function down the line or make seizures harder to control eventually. Another reason why aiming for the best possible control is important. So, yeah, bringing it all together, feline seizures are definitely a serious sign. They need prompt investigation. But that systematic diagnostic approach we talked about is just so vital
Because,
because
like we saw, there's often a specific treatable cause hiding there. And sometimes, quite surprisingly, that cause isn't even in the brain itself.
exactly. Effective management is all about finding that why. Then you either fix the why or you manage the seizures themselves with medication if the cause is ongoing or unknown. And through that whole journey, owner observation, keeping those detailed records, providing safe care, it's all absolutely critical for getting the best outcome.
Thinking about how often something outside the brain, something potentially fixable, can cause such a dramatic neurological event like a seizure in a cat. It kind of makes you reconsider how we view symptoms, doesn't it, in our pets, maybe even in ourselves. That intricate connection between body systems is really quite something. Definitely food for thought.